Hi everyone, this is Alex from Salmonella Place. Today's pharmacology lecture is on anti-anxiety and hypnotic drugs. So the first group is sedato-hypnotics. These decrease anxiety. In a low dose, they have a calming effect. However, they do cause drowsiness and limit the motor skills. Barbiturates are the prototype for this drug. In a low dose, they give sedation and an anti-epileptic effect. In an intermediate or medium dose, they cause a hypnotic effect, decreased motor coordination, amnesia, anticonvulsions, and euphoria. In a higher dose, they give general anesthesia and respiratory depression as a side effect. And in a very high dose, usually seen in drug overdoses or for suicide, there is a coma, severe respiratory and cardiovascular depression. Now, the drugs, as I previously mentioned, which are barbiturates, there are several types. But first, I'm going to talk a little bit about the tolerance. It has an unknown mechanism, but it's usually caused by respiratory depression. It has psychological and physical dependence. So there are heavy withdrawal symptoms when it's taken in a very high dose, such as hypothermia, sweats, and delirium. It is used in circulatory, respiratory, and sleep therapy as a treatment. Phenobarbital, which has a slow onset and long action, decreases the REM sleep cycle and is excreted renally. Pentobarbital, secobarbital, and amobarbital have a quick onset with short to intermediate action. And hexobarbital, thiopental, and methohexital, which are given per os, IV, and again IV respectively, have an approximate half-life of 12 hours with high fat tissue accumulation. These have a quick onset with short acting. Now for the anxiolytics and hypnotics. Chlordiazepoxide decreases the motor skills, but it has less of a sleepy and drowsy effect than benzodiazepines. And anxiolytics, which we mainly use benzodiazepines, these ones, however, don't cause respiratory depression. In a small dose, they cause an anxiolytic effect, sedation, central muscle relaxation, and in a medium or intermediate dose, they cause a hypnotic effect, motor incoordination, amnesia, anticonvulsions, and euphoria. When overdosing, they cause general anesthesia. And when it's very severe, coma, cardiovascular, and respiratory depression, especially when alcohol is mixed with these drugs. I know I'm repeating myself, but I'm just going through the groups so you know what to say for each group. They treat insomnia because they're safer than sedato-hypnotics, anxiety, and they can be sometimes used in a combination with beta blockers because sedato-hypnotics are no longer used for anxiety. They can be used for pre-medication for anesthesia or surgery, for symptomatic therapy in psychiatric manifestations, so there are mood stabilizers, and they can help with drug-induced anxiety or agitation. And lastly, convulsions. So they're mixed with anti-epileptic drugs. Now, the drugs are GABA receptor inhibitors, which are linked to the chloride channels. So the ion channel opens and the chloride enters, and there's hyperpolarization of the cell. This decreases the neuronal excitability. The short-acting drugs are midazolam, triazolam, and zolpidem. The side effects are confusion and anger. Intermediate acting drugs are alprazolam, which is an anxiolytic, and zopiclone, which is a benzodiazepine receptor agonist. Long-acting drugs include diazepam, which is an anticonvulsive, nitrazepam, chlordiazepoxide, and clonazepam, which is a mood stabilizer. These are injected peros, and the side effects for all of these include sleepiness. Severe side effects include cardiovascular and respiratory depression in the case of overdose, and also aggravated sleep apnea. Withdrawal symptoms include insomnia, restlessness, and convulsions. The therapy to treat an overdose is flumazenil. And lastly, other drugs that can be used include buspirone, gepirone, and isoprene. These take 2 to 3 weeks to come into effect. They treat general anxiety, but they have an unknown mode of action. So that's it, guys, for the anti-anxiety and hypnotic drugs. If you want to see more of my pharmacology lectures or other medical lectures, please go to salmonellaplace.com or the other links listed below.